all the syllables for pharmacology. So if you are going to do pharmacology, these are all the syllables. So about 80 topics. We are just doing introduction to about 20 of them today. They'll go full blown into discussing the topics in depth. So look at a group of drugs that is known as what? Local anesthetics. So just define terminologies. When you say something is local in medical terms, it means that the thing will just act around where you put it. If I give you a drug that will act on your body, it's a general drug. But if I give you maybe an injection on the hand and is relieving the pain just around the hand, we say that it's a local drug. So anesthesia, of course, there are drugs that will evade your feeling of feeling pain, your ability to feel pain. I'm just trying to explain to you guys in student language. Some people, this is the best part of the lectures they usually get, So local anesthesias we have here, I'll be classifying them, we'll be defining them, we'll be listing examples of those drugs. We'll not be talking about their pharmacology. Later on, we'll talk about each drug. Okay, I told you guys that we have about 9,556 drugs. These are the total number of drugs used worldwide. We'll talk about each one of them before May 26th next year. So it's all about work, right? So local anesthetics, you should know that there are drugs that block your nerves. So your nerve in front is not able to communicate to the nerve at the back. So there's no communication. So that nerve has pain, but it's not able to push the pain to this other one. So it cuts the pathway for pain. All right. So they inhibit voltage-gated sodium channels. Okay. They also produce reversible loss of sensations in a limited area without loss of consciousness. So local anesthesia, right, is just acting within a particular place. You can think like you are doing surgery with a patient, you are gisting with the patient doesn't even know that you are stitching a wound on their leg. Do you understand? So local anesthetics, they are mostly used for mild conditions. If I'm supposed to do a crazy surgery for you, I'll give you a general anesthesia that you blow off, you just sleep off for the whole time. So classification of local anesthetics, we have the esters. Those are the ones that are derived from the esters. We have the ones like cocaine, the one that guys abuse the most. Okay, so cocaine is actually a drug. It's a legal drug. Okay, it's a legal drug prescribed in the hospital. Then we have the Procaine. All right, we have the Procaine. We have the Tetracaine. We have the Benzocaine. So this was mainly, they are derived from esters, right? So what's the next classification? We have local anesthetics that are derived from amides. Okay, so drugs like what? Lidocaine. I think I have their pictures here now. Let me see. Yeah, I see Lidocaine. I have a picture of Lidocaine here. This is Lidocaine. What again? We have Bupivacaine. We have the Mepivacaine. We have the Ropivacaine. We have the Prilocaine. We have the Etidocaine rather. Etidocaine. So you can see that all of them end with cane. So this is one of the, how will I put it, concepts you can use to be cramming these drugs. In pharmacology, right, you cram before you know. Okay, don't go and start saying you want to know things first. Okay, cram before you know. Just know the list of the drugs before later on you're now looking for details like how does this drug function and all of that. So generally, how do these drugs work? So they usually bind to the intracellular portion of the voltage-gated sodium channels. They block sodium channel from coming in. They block sodium from coming in. They block the channels of the receptors, so they will block the real sodium from coming in. Of course, is when sodium comes in, that's where signals are transmitted, pain is transmitted, contractions usually cause more pain. Do you understand? So if you are blocking all of that, you relax the whole area and there's no pain. So that's just it. Alright, that's just how they work. Okay, so they inactivate channels. Do you understand? So that's what we got. So factors affecting local anesthetic action is the pH. Is not really a good topic. It's not really a good topic, right? I just know it from the introduction like that. So clinical uses. They are used to relieve pain within a place, nerve block, epidural. That's when the woman wants to give birth and there's too much pain. Okay, so they just give her the injection around the spinal cord. So from the waist down, there's no pain. So the baby is just pushing out, no problem. All right. Then topical anesthesia. That's when you're having wound on the skin, so you want to just relieve the skin, or you have a wound on the skin, so you inject it around so that I can stitch the wound. I know we used it when we were in obstetrics, when women give birth, when they deliver, and there are tears, okay, in the perineum. That's perineal tears, right? So when they have perineal tears, usually what inject those lidocaine, right? Most of the times, so you inject the lidocaine and or bupivacaine, so to just relieve the pain around that perineum, so they can stitch it off for her, right? So but sometimes if you inject it and you are stitching for a very long time, the effect goes away and the woman start complaining, so you see inject another one. So that's how we do it. All right, so that's it. Adverse effects, CNS toxicity, tinnitus. I don't really like talking about adverse effects of drugs that are still being used. Why? Because sometimes they give a negative picture of that drugs, and 90% of times if you take those drugs, you won't even see those adverse effects. So for medical students, you know that